The name of this paper is Assessment and in Guidance and Counseling. When we talk about assessment, it is important to know that why do we need assessment in counseling? In order to resolve any issue, in order to solve any problem, it is important that we have a clear understanding of what the problem is. And assessment helps us in doing that. Assessment helps us in a couple of ways when we are dealing with our clients. Firstly, it helps us understand the behavior patterns of the client. It also helps us understand the specific issues or concerns the the client is facing. Along with the nature of the issue, okay. So now when we talk about assessment, when we use the term assessment, we start this process from the moment we see our client for the first time. How the client is appearing, or what is the physical appearance of the client, what the manner in which the client comes to us, the manner in which the client shares his or her concerns in the manner in which the client shares his or her concerns is also a part of assessment. So we start the process of assessment starts from the moment the client comes to us. As a counselor, we will regularly assess our clients throughout the process of counseling. So we'll assess the client throughout from start to finish. However, most of the assessment will take place in the earlier stages of counseling. So let's take a case which will help us understand in the process of this entire paper what we are meaning by assessment. Let us assume you are working as a school counselor, and this school is specially designed for children with special abilities. Now, one of the responsibilities that you are given as a school counselor is to monitor the progress of these students on a continuous level. So you have to do an ongoing assessment of the progress made by the students in various areas. So now you as counselors, you have to decide. So now when we are talking about assessment, firstly you will have to create markers of various areas that you are planning to assess. Are you going to base your assessment on their academic level? What are the other areas that you will include in your assessment? Their personal skills, cognitive skills, interpersonal skills, so physical development. So firstly, you will have to list down various areas of that you will use, that you are going to use to measure their performance. After you list these areas, then you will have to come up with appropriate tools for assessment. So for example, if you are going to use physical growth as an area of assessment, then what are you going to measure? Height, weight. So then that will be your tools of assessment. If you are going to monitor their interpersonal or communication levels, if you are going to measure the intelligence of the IQ levels of these children, then you will have specific tools or techniques that will help you measure those areas, and that is something that we are going to study in this paper. Okay, so now let us see what are the various objectives of this paper. This paper has 4 basic objectives that you are going to cover in the course of studying this paper. The first is to understand the concept of testing from a psychological perspective. Now, when you go through different websites, when you go through different programs on the internet, you're going to see various questionnaires or various tests that claim to measure certain aspects of you as an individual. So there will be certain tests which will say that they will measure how much introvert or extrovert you are, or there will be certain tests which will measure your emotional intelligence. There will be certain tests that will measure the level of aggression. However, when we say testing from a psychological perspective, the tools that we use need to have certain parameters, need to be meeting certain guidelines before we use them. So these tests may not be as accurate, these tests may not be as valid as the ones that we use in psychological testing. So we need to understand how we are going to use these tests and what are the various aspects that we need to understand before applying or before scoring these tests. The second is, we will see what are the various aspects of this test. So the test, we'll have to apply the test, then we will have to score the test, and then we will have to bring meaning to the results of the test. After we bring the meaning to these results, we will also have to apply the results in order to meet the needs of the client. So we'll understand all these different aspects of psychological tests, and we will also understand what are the various types of tests that we will be using as counselors, as guidance officers, or psychologists when we are working with our client. So like other papers, this paper also has 5 units. We'll start with each unit and we'll see what are the various concepts, what are the various things that you will cover in each of this unit. The first unit is called psychological tests. Now, when we say what a psychological test, it is basically a tool or an instrument. It is designed to measure something that is latent. So, behavior, as we had spoken in the previous chapter, is the most observed or most observable aspect of an individual's personality. However, this behavior is a result of many unobservable or many latent variables, which include emotions, which include thoughts, core beliefs, values, so on and so forth. So to understand these latent variables, we need to use certain tools or certain instruments. These instruments are called psychological tests. So there are different types of psychological tests, some of which are a series of problems that we have to solve. So psychological tests like intelligence test or aptitude test will bring a series of problems in which the subject of the test will solve these problems, and based on the result we will be able to measure their aptitude or intelligence or creativity. Another type of tests are where a subject will have to select a response from a series of responses. So a situation will be given to the subject and a series of responses will be given. So the subject has to decide what is the response the subject will select. So let's say there is a test on subjective well-being, or there is a test to measure the altruism in individuals. So here the subject will be given a situation and 4 options from which the subject has to select one option. And based on the responses, we will be able to understand the beliefs that underlie the thinking of this subject. Psychological testing is a process of administration of psychological tests which are designed to be an objective and standardized measure of a sample behavior. So these tests are objective in nature. When we apply the psychological tests, we need to understand that our subjective biases or our judgments should not color the response of the client. Also, these tests are standard in the sense that before the test was actually developed, it was given to a number of people, and it was standardized so that the responses will be able to score on a general or a normative population. Now, when we talk about tests, the second unit talks about what are the characteristics of a good psychological test. So here we are going to discuss 5 basic characteristics that will define if the psychological test is good, in the sense if it actually meets the standard of a psychological test or no. In this chapter in this unit, when you study in detail, you will also learn that if you want to develop a psychological test, how you will be able to maintain these standards while developing a particular test. So the first characteristic is objectivity. So while framing the questions should not be judgmental, in the sense that your own understanding of the world should not reflect in the questioning format, and hence the test should be subjective. For example, if we are talking about an intelligence test, and in the test we are using currencies or we are using measurement, then we need to know that different countries use different currencies or different tools of measurement. Hence, in order to make this test, or in order to make this question objective, we need to have the option of changing that currency or tool or the weight or the measurement that we are using. The second is reliability. Now, reliability means the same, for example, if we talk about an intelligence test. So, if we give this test to one person, this person should, the result of this test should be in congruence with the result of other intelligence test. So, for example, if we already have different tests of intelligence, like Stanford, Binet, so if the person has applied this particular test, like say WISC or WACE, and then the person is applying your intelligence test, then the results should be more or less similar. The third is validity. Validity means that the test should measure what it says it will measure. So now in reliability, let's say for example, reliability is like a weight scale. So if you stand on the weighing scale 5 times, the weight should be same. Or if you measure your temperature with a thermometer 5 consecutive times, it should be same or similar. That is reliability. Validity means in order to measure weight, you will not use a thermometer, because a thermometer does not measure weight. In order to measure temperature, you are not going to use a weighing scale. So the test should measure what it actually says it will measure. The fourth characteristic is norm. Now, when we are giving your subject a particular test, you need a parameter to compare the scores of this particular subject. For example, when you measure weight, again I am going to a physical measurement because it is easy to explain. So when we are measuring weight, we know that there is a certain parameter that the body mass index will say whether the person is underweight, overweight or obese or normal. Similarly, when you are measuring IQ levels or intelligence levels, when you are measuring certain personality traits, you should also have certain parameters or certain norms that will say if the score was above average, average or below average, or if the score has certain meaning with regards to the client. The fifth is practicality. In simple words, the test should be practical. The test should not be very lengthy because the subjects may not have longer attention span. Also, longer tests or more items means the test will become very difficult to score. So it will not be practical for the subject or for you as a scorer. So these are the five characteristics of a good psychological test. When you study this unit in detail, you will be shown what are the different ways in which you can measure these characteristics. So how can you measure the reliability of a test? How can you measure a validity? A validity of a test? How can you set different norms for your test? And it will also show that how can you improve or make your test more objective, reliable, so on and so forth. Now this brings us to the third unit. After we have seen what are the various forms of psychological tests, we should also know that psychological tests are not the only means of assessment. There are different forms in which we can understand the client's behavior apart from these assessments. So in the next unit, you will study what are the various techniques of assessment. The first technique is called clinical interview. Now, when we talk about clinical interview, it is the interaction that you have with your client, and you try to gather as much information from the client as you can. So you will gather the information about the problems of the client, how the client has tried to solve this problem, whether the client was able to resolve it or no, and why the client was not able to resolve. So these are the things that you will talk about in the clinical interview. Every organization again will have a format that you will have to follow when you are conducting this clinical interview of the client. Then assessment of intellectual functioning. So you will also have, if necessary, based on the need of the client, you will also do an IQ assessment or an intelligence test assessment. It may not always be paper and pencil, but it may also be performance based assessment. Then we'll talk about personality assessment. To understand the various traits or characteristics of the client, sometimes we need to do a personality assessment. This will help us understand if the client has specific traits, introversion, extroversion, traits based on even sexuality, or traits based on certain psychiatric conditions like depression, anxiety. These assessments will help us understand if or no the client has these problems. We will also do a behavior assessment. Now, behavior assessment will happen throughout the clinical interview. We will see how the client is dressed up. Is he appropriately dressed for the occasion? Is he well kept in the sense, has he taken a bath? Has he shaven off, or has the hair been properly combed? Is the client in proper is he properly dressed according to the clinical setting? Then is he able to converse with you properly? Is he able to answer your questions? Is the gait of the client proper or no? Or the client is not maintaining eye contact, or the speech of the client is not proper. So all these things will come in behavioral assessment. Is the client shy? Is the client aggressive? Is he not speaking fluently? Do you feel that the client is hiding something purposefully or not opening up to you as a counselor? So these are the things that you will use as techniques of assessment during your process. And based on these techniques, you will come up with the plan of treatment. So the diagnosis of the client will be based on this assessment. and based on your diagnosis, you are going to come up with the intervention strategy for this particular client. So now we have spoken about clinical interview, we have spoken about behavioral assessment. These two techniques are mainly based on your skills, and there are parameters when we talk about these two methods or techniques of assessment. However, these are based on the organization that you are working. So when we talk about clinical interview, it has firstly the basic background of the client. For example, name, age, gender, sometimes even family composition. Then we talk about the current problems, that what are the problems that the client is facing at this particular moment. Is it mood swings? Is it a lack of confidence? Is it anxiety? What are these problems? Since how long is the client facing these problems? Are these problems a result of a specific event, or they have started out of a blue? If there is a particular event associated with these problems, then you can address the event. If the problems have suddenly come up, then what is the reason for these problems coming now and not before? Is the client aware that the client has this problem, or the client is not willing to agree that he or she has issues or problems? We also need to see if the client has tried seeing doctor, medications, or has seen some other spiritual leaders for help. Because what happens is sometimes students or children with mental retardation or learning disabilities, parents also go and seek spiritual help or help from other sources. So we need to see that if the client has gone to these sources, because this will help us understand the mentality of the parents in a better way. And we need to see if the client has seeked this treatment, has this treatment been useful. So these are the things that will help us understand the clinical part of the client's problem. When we talk about behavioral assessment, as I had spoken earlier, the first and foremost thing that will come to our mind is the physical appearance of the client. After that, we need to understand the speech. How is the client talking? Then the thought processes. Do you think that the thought processes is in sync with what he is talking, or do you think the client has delusions, or the client has problems in understanding what you are saying? The client is not able to formulate sentences properly. After understanding the thoughts, we also need to study the emotions. Is the client extremely sad or anxious or overly happy? Or also the emotions of the client, are they in sync with what he is saying? For example, the client is relating a very sad event of his or her life, but the client is smiling and the client is not showing any any emotions that a normal sad person would show. So that you need to see. You also need to see if the client is properly sitting, the client is able to pay attention to what you are saying, or the client's mind is wandering and he is not able to continue conversation, and you have to bring the client back again and again in your conversation. You might also need to do certain tests to see if the client is in proper state of mind, like asking him date or time, to see if the client is aware of the changes, because sometimes the client may not be aware of what time of the day is, what date is. So depending on the condition, you will have to do a complete behavioral assessment of the client. In some clinical terminologies, it is also called present state examination or the current state examination. So these things will give you the current situation or the state of mind of the client. The other two tests that we had spoken about, intelligence functioning and assessment of personality, This is something that we are going to deal in detail in the next unit. So coming to unit 4, the name of the unit is Test of Mental Ability, Interests, Value and Personality. So here we talk about 4 different types of tests. We talk about intelligence tests, personality tests, then tests of mental ability, and specific tests for specific psychiatric conditions. So when we talk about intelligence tests, there are 2 types of intelligence tests. The first is paper and pen, in which the student or the subject will have to solve problems using a paper and pen. So there will be verbatim or a lot of words will be used in these kind of tests. The second kind of test is personality test. Here, instead of using paper and pencil, you will be using other parameters that will test a child's intelligence. So a small list of different intelligence tests is as follows. The first one is Stanford-Binet Intelligence Scales. The second one is Woodcock-Johnson Tests of Cognitive Abilities. The third one is Raven's Progressive Matrices. The fourth one is Wechsler's Adult Intelligence Scale. And there is also a Wechsler's Intelligence Scale for kids. Then there is a Cattle's Culture Fair Test. Then there is a Reynolds Intellectual Assessment Scales. And the last one is Thurston Primary Mental Abilities. Now there are many other tests also, but these are some that are used more frequently. Now when we talk about these tests and when we are talking about other tests also, every test will have 2 things. The first thing is the scoring. The second thing will be norms. Scoring will tell you how to rate the performance of an individual on these tests. And norms will tell you how to take out meaning of these particular scores. Also, you need to see that some of the tests will have norms for Western population. Some of the tests will have norms for Indian population. Now, when you are conducting these tests on Indian population, it will be better if you can use those tests which have Indian norms as well. Since the abilities, the culture of the Western environment and Indian environment is different, the norms are developed to suit the local population. Also, some of the tests might be available in regional languages. If you can get them, it is all the more better to use them, since your subject or since the client will be able to comprehend them in a better way and solve them in a much better way, and hence you will be able to measure their abilities far more better. Now we have covered the intelligence tests. Now we'll see the personality test. Now we have spoken about different theories of personality, and these tests are based on these theories. So for example, a test that will measure introversion and extroversion will be based on the introvert-extrovert theory of personality. So there are certain tests which are personality theory based, and there are certain tests that are holistic. So holistic tests would be something like Minnesota multiphasic personality test, or projective techniques like Rorschach ink-block technique, or thematic apperception test, that is TAT. So these are generic tests. However, there are certain other tests like 16PF or the Myers-Briggs type indicator, or the Eisenhower personality questionnaire. So these are based on specific theories of personality. Depending on the client's condition, you will be using these tests. Very rarely projective tests are used. When you feel that the client is not giving proper answers, so the client might be faking on the other tests, you can use projective techniques. Then we talk about mental abilities. Now, when you are doing vocational guidance, when you are doing career counseling, you need to understand what are the special abilities of your clients or of your students. In these situations, you would be using uh, these specific tests. So, for example, if you want to see what are the various cognitive abilities of the client, then you will use cognitive ability tests. Now, there are certain specific tests like verbal reasoning or mechanical reasoning. So, mechanical reasoning would be mainly used with engineering students, or diagrammatic tests would be mainly used with architecture students. So, there are certain specific, so all these tests measure specific abilities, specific interests of your students, of your subjects, so that you will be able to see if the child has an ability, has skills that are required for a particular job. So these are three types of generic tests. Now there are some tests that will help us understand the extent of psychiatric problems if the client is having any. So if, let's say, the client has social anxiety, so there is a specific test that will measure how much or to what extent the client has social anxiety or depression or obsessive compulsive disorder. So there are specific tests which are used for these purposes. Even problems like addiction can be measured using specific tests. Now coming up to the fifth and last unit, it is called application of testing. So now there are different areas in which we will use these tests. We will use in educational setup. Here we will use the test to understand the intelligence levels of our students. So we will use intelligence tests. When we are doing vocational guidance, we will use aptitude tests. When we are measuring the performance of the students, we will use performance test. So depending on the aim of testing, we will use different types of tests in educational level. In occupational level also, we will use, if we are recruiting somebody, we will use intelligence tests or aptitude tests. We will also use interest tests if we are in the profession of career guidance or career counseling. Then when we are working in a clinical setup, here the personality tests will be used more. We will also use specific tests that are related to anxiety, depression or addiction based on the requirement of the case. Also, when we are working in hospitals, these tests like thematic apperception test or Rorschach-Singh block test will be used more often. When we are working as counselors, we may not see people with severe psychiatric conditions. We may see people with normal day-to-day adjustment problems, and here we may not use these specific tests for depression or anxiety as much as we use in clinical setup. However, we will use personality tests or tests that are used to measure specific traits of individuals, like introversion or extroversion test, then locus of control test. We will also use 16PF. We will also use MMPI, because that will give us a complete or holistic understanding of our client's personality. So now a couple of things that you need to remember when you are doing testing. Firstly, the test that you are using should have the characteristics that we had spoken about, the parameters like reliability, validity, norms, objectivity. Then you should understand or give proper reason as to why you are using this test. Don't just randomly pick any test and use it. Every client or every situation will need different kind of personality test that you have to use. Hence, give proper reasoning before using any specific test. Now, after using or after applying that test, make sure that you are properly scoring it. In the beginning, you will have to discuss with your supervisor before drawing out meaning out of that particular test. Just applying test is not enough. You will have to work with your supervisor to see if you are properly scoring it and you are using the norms to properly bring out the result. Hence, a small tip would be that practice on your friends and colleagues these tests as much as possible. If you have this test, then you can practice it, and only practice will help you able to calculate your results more effectively and score them more accurately in future. So that's all, friends. That was the unit and the last session of this series. I hope you found this motivating enough to read different books on this topic, and all the best for your course. Thank you very much.